Over the past 100 years, modern science has been responsible for some miraculous inventions to aid the delivery of medical treatments such as the X-ray machine, ultrasound technology, and the cochlear implant. One of the latest improvements is the field of robotic surgery, which is redefining the way in which patients undergo procedures. Not to be confused with computer-aided surgery, robotic surgery utilizes the robot to actually perform the manual tasks of the surgery. Robotic technology is designed to extend types of procedures that can be performed by minimally invasive surgery to a wider array of patient types. Where human doctors require large open areas to undertake operations, robotic technology offers the clinical and technical capabilities operating through tiny incision. The numerous benefits of the patient include a reduced risk of infection and blood loss, speedier recovery time, and less scarring. Shorter post-operative recovery time in the hospital may help to alleviate some overcrowding and waiting time. One example of how far technology has come is the Da Vinci surgical system. The system, which is divided into 4 key elements. The surgeon console allows the surgeon to operate the controls with his or her fingers from a seated position. The vision system integrated into the console provides viewing of the surgical field via a 3D image. The patient side card comprises 3 or 4 robotic arms, 2 or 3 instrument arms, and 1 endoscope arm that performs the commands as dictated by the surgeon. Wrist instruments enable the surgeon to perform tasks such as clamping and stitching, as they are designed with 7 degrees of motion that mimic the dexterity of the human hand and wrist.
General information I know about robotics is that it's a continually developing field, and most robotics are used in the manufacturing process. So basically it uses a combination of mechanical arms that are computerized to do certain tasks. In this case, what robotics has done is it's taken over the amount of humans that need to do work.
SRI International, a Silicon Valley-based independent non-profit research and technological development company, has announced it will conduct the first ever robotic surgery demonstration in a stimulated zero-gravity environment.
The advantages of it are a factory can do things that are more automated. It can run like 24 hours. It can be more precise and accurate, and it would be less cost for the factory. The disadvantage is that you're taking humans out of the equation. If robots can't necessarily think outside of a certain formula that is given. So if you go beyond that, where humans can think more critically about something, and then lastly, it's your jobs are being lost to robots, you could say, because you have more robots doing the work of humans, and that's taken over a human job. Well, I think there'll be more robots down the road, yeah. That's my opinion. I don't know when that'll happen. I definitely, if you go to any factory today, you'll see a lot of robotics at work, today. So we're definitely moving in that direction for manufacturing processes. Whether or not we'll see them in our everyday life is another thing, but I think it could go that direction. Like especially if you think of like nursing care, like if somebody is really sick and they need something there to kind of make sure they're doing okay, then I could see a robot being useful because they could be there 24/7 assisting, and if something happens with the oxygen levels or they need to replace a tank or something like that, a robot could easily do a lot of the mundane tasks. But I don't think a robot could ever replace humans for critical thinking, being able to think abstractly. I don't think they could ever have a robot replace some of those thinking forms of the human, including emotion.